Good morning, everybody, and thank you for being here this morning. My name is Bechara Choucair, and for those of you who I haven't met, I served as Kaiser Permanente Chief Community Health Officer. At Kaiser Permanente, we have a long history of providing healthcare services and conducting medical research that understands and addresses understanding the risk to improving patient outcomes and support healthier communities. We know that firearm injury is a leading cause of preventable deaths in the U.S., and we think we can leverage what we do best to help tackle this issue. Whether it's suicide, homicide, accidental firearm deaths, we can contribute to prevention. Every single day in America, health professionals find themselves on the front lines of treating patients injured by firearms. From our emergency departments and primary care settings to behavioral health and specialty care, there are many touch points where healthcare systems grapple with firearm-related injuries and death. Supporting these dedicated professionals is the right thing to do for patient care and also for the well-being of the communities we serve. We are committing to studying firearm injuries the same way we study the prevention of cancer, heart disease, and other leading causes of preventable death in America by leveraging our research expertise, rich data sources, and delivery system environment. And let me be clear, this is not about personal or political positions around guns. It's about how we leverage science and research to guide what we do in our hospitals and our clinics and to solve a public health issue. Every year, firearm-related injuries claim more than 30,000 lives in America and cause almost 85,000 injuries. And this hits particularly close to home at Kaiser Permanente in our 12.2 million members. In 2016 and 2017 alone, Kaiser Permanente physicians and nurses treated more than 11,000 victims of gunshot wounds in our health system. And like other epidemics, there is much inequity in its impact. 7 children and teens are killed by firearms in the United States on an average day. Black men are 13 times more likely than white men to be shot and killed. And 50 women are shot to death by intimate partners in the United States in an average month. This is a big part of the reasons why, in April of 2018, Kaiser Permanente announced a $2 million investments in research for firearm-related injury prevention and the formation of this task force to address critical health issues around firearm-related deaths and injuries. And I'm so glad that I'm able to co-chair this task force with Dr. David Grossman from Kaiser Permanente, who's sitting right here in the room with us as well. We all have a responsibility to come together, health leaders and clinical care providers from across the country, to co-create solutions to end this critical public health crisis, which is why I'm so thankful to the National Academies of Sciences, Engineering, and Medicine for convening this workshop today. Our work together is not just about further describing the problem, but it's about finding ways to solve it. And that's why I'm particularly excited about this two-day workshop. It's not just about further describing the problem, it's about finding ways to solve it. And our task force, comprised of clinicians, researchers, and policymakers at Kaiser Permanente, is identifying research priorities. Working closely with internal experts, the task force is developing and planning to disseminate evidence-based protocols and resources for physicians and other health professionals, healthcare delivery systems, and community partners nationwide to save lives. There is no one magic solution to ending this health epidemic, but there is a growing appetite to address it, as evidenced by the deep expertise in this room.